Hello, this is Philip with a closer look at the various functions of our patent-pending COVID-19 recovery breath assist device. This device uses an ambu bag valve mask, a common and inexpensive piece of medical equipment found in most medical facilities, and pneumatics to change this mask from a manual, hand-operated breathing device to an automatic one. The device has several modes of operation which I want to highlight now. Firstly is the simplest mode, that of a standard ventilator device. In this configuration, the device enhances a patient's inhalation. This is done by pressurizing the chamber that the mask sits inside, which compresses the mask and delivers air to the patient. The mask refills due to the elasticity of the plastic that it's made of, naturally reinflating the mask back up to normal size, after which point the mask can be compressed again. Second is the mode with the vacuum on the chamber turned on. This vacuum sucks air out of the pressure chamber faster than it leaves naturally, reinflating the mask faster than it would when in normal use, and allowing it to be used again sooner. This allows the device to have a higher respiratory rate than is normally possible with such a mask, when being used by hand or by an alternative mode of mechanical compression. Third is the mode with the vacuum removing exhaled air out of the breathing tube. In this mode, when the patient exhales, the vacuum sucks this air out, enhancing exhalation of the patient. This allows tidal volume, the volume of air breathed in and out, to be drastically increased, as it allows for some of the expiratory reserve volume, which isn't normally usable non-invasively, to actually be utilized. This can help with things like high blood alkalinity by cleaning excess CO2 out of the lungs, or with allowing the patient to utilize more of their alveolar area in case of damage to some part of the lung, like some COVID patients have seen. Fourth, to be presented in an upcoming video, is a pneumatic belt that is placed around the patient's ribcage that uses gentle negative pressure to further enhance the functions of the rest of the device. Any or all of these settings can be turned on in any combination and adjusted at will. Several of these functions are completely novel, and as such there isn't really any concrete data about how effective they may be. But I hope you stay tuned as we bring this prototype closer and closer to completion status, showcase more of its functions, and monitor its effectiveness.